Okay, Amber, we're at the hospital now.
This is Amber, 12 years old, coming in from Camp Oakwood. Ready? 1, 2, 3. Nicole, her counselor, saw her dive in the pool and noticed she didn't come up. Nicole jumped in and pulled her out, noticed she wasn't breathing, and began giving her rescue breaths. Amber finally started breathing on her own right before we arrived. Vital signs stable en route, initially unconscious, now slowly coming around, but still not oriented. She just started asking repeated questions.
Was she conscious before she entered the pool?
Yeah, she was fine. She was playing with her friends and then she dove in.
Okay, so we can be sure it was the impact that knocked her out. How long was she in the water?
I guess about a minute before I could get to her.
So she probably got some water in her lungs. But if she experienced a laryngospasm, she might not have. We'll find out. And how long did you give her rescue breaths before she started breathing?
It was about 5 minutes.
Amber, my name is Dr. Grayson, and we're going to take good care of you, okay?
2, 3.
Amber, can you tell me how old you are?
At the hospital.
Amber, can you tell me what happened?
Hospital.
Okay, 1, 2, 3.
Okay, she's still very disoriented. She's raspy, and her lung sounds tell me she still may have water in her lungs.
Blood pressure's at 111/66, heart rate is 79.
She's at 22 breaths per minute.
Oxygen saturation levels at 93% on 2 liters of oxygen.
Okay, that's a little low. We may want to turn it up to 4 liters. We did look at her pupils and they seem fine.
Okay, her pupils are behaving normally. She's moving her arms and legs, which is a good sign, no paralysis. But she's got that nasty bump on her head. She's very disoriented, and I don't like her breathing.
She's starting to breathe pretty fast, which tells me her body needs more oxygen. Also, with her blood saturation at 93%, it's definitely telling us she needs more oxygen.
Okay, I want to run a couple of tests. Let's get a blood sample and check out the oxygen level in her blood. Also, I want to run a CT scan and get an image of her head and spine. I want to confirm that she has no nerve damage, and I want to confirm that there is no bleeding. And let's keep an eye on her breathing.
Dr. Grayson, we need you in here stat.
What do we have?
She's climbed to 40 breaths per minute, shallow and rapid, and her oxygen saturation level fell to 70% on her way back from CT scan.
What does that mean?
Normally, she should be at about 18 breaths per minute, and she's at 40. Her body still doesn't think it's getting enough oxygen, and it's right, because her oxygen saturation level should be at 100%, and it's only at 70.
Remember how we thought she might still have some water in her lungs?
Yeah. It's my bet that her lungs are reacting negatively to the chemicals in the pool water. Because of that, she's not getting enough oxygen in her system by breathing on her own. We need to intubate her.
We're putting an intubation tube down her throat to open up her airway and help her breathing out until we can get her body to counteract the negative reaction of the pool chemicals.
Is she gonna be okay?
I know this is very scary, but we're actually getting her stabilized. I reviewed the results of the CT scan. It looks like there's no nerve damage, just as we hypothesized. And there's no brain bleeding from the impact, which is a very good sign. We're going to keep some extra pressure in her lungs to force the water out. And we're giving her medicine to help with the swelling in her lungs. If you're up for it, I think we should go call the parents and give them an update.
Absolutely.
Okay.
Hey, Amber, you're awake.
Where am I?
You're at Mission Hospital. You dove into the pool at camp and hit your head on the bottom. It knocked you unconscious, and you've been here for the past 24 hours.
And where am I?
You're...
Amber, you're at the hospital. My name is Dr. Grayson. Sometimes with a bump to the head, people might repeat questions for a day or two. Amber, you might have a little trouble remembering things for a little while, but you're going to be just fine. When we have incidents like this in a swimming pool, the chemicals in the water can be a little tough for your delicate lung tissue to handle. We had to help you breathe a little better than you could on your own. So we had a little tube that was pushing air into your lungs.
They also turned you in the bed a few times to help force some of the water out. And they gave you some steroids to take down the swelling in your throat.
Steroids? Like the baseball players?
No, not exactly. But the medicine will help you heal a little faster. You'll need to take it easy for a few days. Her memory and the repeating of questions may continue a bit longer, but it looks like there's absolutely no permanent damage. Just don't go sneaking into any more pools after hours, okay?
Okay.